When the government suddenly announces a recall or even talks about pulling a product from the shelves, it's normal to assume that some unexpected defect has recently been discovered. Maybe the feds have noticed that a car's airbags don't deploy during a crash, or that a certain brand of fish tank is prone to spontaneous implosion. Whatever the case, you're inclined to think that some new information has come to light that necessitates the recall, and in most circumstances that's true. But there's one industry, Big Pharma, that has consistently been the exception to this rule. This is an industry that happens to enjoy a lot of special treatment from the federal government, including immunity from lawsuits. In the pharmaceutical industry, a recall doesn't necessarily mean that some catastrophic defect has just been identified. Instead, it often means that there's been a known problem for a very long time, one that's been deliberately hidden from the public until finally it's impossible to deny any longer. After COVID, most of the country realizes that this kind of thing can happen and does happen all the time. What they might not realize, because there's a mountain of propaganda designed to hide this fact, is just how frequent this is. So here's the latest example. Right now, the pharmaceutical industry is debating whether to issue one of the biggest recalls in modern history. The recall would affect a wide array of over-the-counter cold medicines, including some products bearing the brand names of Mucinex, Tylenol, Sudafed, NyQuil, Benadryl. The reason? Well, according to the government, these products don't work at all. Now, to be clear, as we'll explain in a second, some Benadryl and Sudafed products do work, according to the government. We're talking about a certain but very popular subset of these over-the-counter products that use a specific ingredient. At the same time, if you're one of the hundreds of millions of people who have consumed these products over the past decade, this is a big headline, or at least it should be for you. I mean, you paid money for a product that you thought worked on assurances from the government and Big Pharma. You ingested this product into your body based on those assurances. And now you're being told that these pills had all the effectiveness of like eating a cookie and drinking some warm milk. One of the first questions you think to ask under these circumstances is when exactly the regulators and the pharmaceutical companies figured out that these products are completely useless and ineffective. If you listen to most news reports on this subject, you'd be left with the impression that some kind of new information came out. But that impression would be completely wrong. Yet it's what they're presenting. So here, for example, is CBS News giving off this impression. Watch.
Popular over-the-counter medicines that many of us use for cold and allergies, they don't work. This according to an FDA committee looking into phenylephrine. It is the main ingredient used in over-the-counter nasal decongestants that many of you probably have in your medicine cabinet right now. I know I do. It's in Sudafed PE, Mucinex Sinus Max, Theraflu, Vicks Dayquil, NyQuil, Severe Cold and Flu, among others. The committee looking into the drug says it's ineffective in oral medications. If the FDA ends up agreeing with the committee, those products with that in it could be removed from store shelves. In a statement, the Consumer Healthcare Products Association says the ingredient is safe and effective.
Talk to your local pharmacist, local provider, about what the alternatives are, because there are that can be used effectively.
And the panel of advisors told the FDA that using the drug at higher doses is not an option because it can raise blood pressure to potentially dangerous levels.
What's left unmentioned in that report is that this significant alleged defect in these drugs, the fact that they don't do anything, has been widely known for years. It's not new information. Nearly a decade ago in 2015, researchers at the University of Florida said that they found conclusive evidence that many non-prescription decongestants didn't work. Quote, scientific evidence continues to show that the most popular products on the market containing phenylephrine are ineffective. Phenylephrine, to be clear, is used in certain drugs like over-the-counter Sudafed. It's not used in the brand of Sudafed that you have to get from the pharmacist, and we'll talk about that in a second. The researchers continued, quote, we think the evidence supports that phenylephrine's status as a safe and effective over-the-counter product should be changed. We're looking out for the consumer, and he or she needs to know that science says that oral phenylephrine does not work for the majority of people. Now, that was back during the Obama administration. Again, that was in 2015. The findings raised a lot of uncomfortable questions, such as, why would the FDA approve a drug that's effectively a placebo? Why were regulators still allowing Big Pharma to sell it? Why were people continuing to buy drugs that didn't do anything? Where are the prosecutors? Where's the court system? I mean, isn't it fraud to advertise products that don't work? Should there be penalties for making billions of dollars off of something that doesn't do what it's supposed to do? By refusing to do anything about phenylephrine, the federal government dodged all these questions. They also helped cover up their role in causing the problem in the first place. You know, you rarely hear this discussed, but the supposedly useless ingredient in question, phenylephrine, wasn't always used in medications like Sudafed. 20 years ago, the key ingredient in the most popular form of Sudafed was a very different decongestant called pseudoephedrine. And this ingredient, we can be reasonably confident, actually does work. But in 2006, the federal government made it a lot harder to get real Sudafed with this ingredient. Congress passed a law effectively requiring people to, undergo a background check before they could walk out of the store with it. Real Sudafed was no longer an over-the-counter medication after this law. Before that, it was. And the justification for this restriction, ostensibly, was that they were trying to stop people from using the ingredient to make meth. We'll be taking a lot of dangerous drug kingpins off the streets, they told us, if we just take this kind of Sudafed and we put it behind the pharmacist's counter. Once Congress passed that law, Big Pharma needed an alternative. Most customers don't want to wait in line for a pharmacist every time they need a decongestant. They don't want to have to, they don't want to go through all of that. So they'll leave the CVS without making a purchase. So very quickly, Big Pharma came out with a new form of Sudafed using a different ingredient called phenylephrine. Big Pharma and the federal government told us that it was the best of both worlds. This new form of Sudafed can't be used to make meth. At the same time, we were assured it's just as effective as real Sudafed. Now, shortly after that law was passed, there were reasons to doubt the narrative that the government was pushing. For one thing, because of all these changes, a lot of innocent people were arrested for no reason. One of them, just as one example, was named Tim Naveau, and he was charged with a federal crime for buying too much Claritin. He wanted to get some extra pills for his son who was going away to camp, and in response, local officials arrested the man. They didn't care that he wasn't making meth, and he wasn't. They charged him anyway because he was collateral damage, I suppose, in the larger meth war, which this legislation would help the federal government win. Nearly 2 decades later, we learned that nothing we were told turned out to be true. For one thing, meth has never been easier or cheaper to obtain in this country than it is right now. It's not coming from domestic meth labs for the most part. Instead, it's coming from Mexico across a border that the federal government has deliberately left open. And on top of that, according to the government, the substitute Sudafed and related drugs were not effective, as we were promised they were. They're useless. The new narrative is that Big Pharma made billions of dollars every year selling products that did not work, and they knew it. The federal government let them do it. Well, a company is looking out for you when they actually upgrade your service and don't charge you for it. This is great news for new and current Pure Talk customers. Pure Talk just added data to every plan and includes a mobile hotspot with no price increase whatsoever. If you've considered Pure Talk before but haven't made the switch, take a look again. For just $20 a month, you'll get unlimited talk, text, and now 50% more 5G data plus their new mobile hotspot. This is why I love Pure Talk. They're veteran-owned, and they only hire the best customer service team located right here in the great USA. Most families are saving almost $1,000 a year while enjoying the most dependable 5G network in America. Remember, you vote with how you spend your money, so stop supporting woke wireless companies that don't support you. When you go to puretalk.com/Walsh, you'll save an additional 50% off your first month because they actually value you. That's puretalk.com/Walsh. Pure Talk, wireless for Americans by Americans. Innovation Refunds has been helping small businesses that qualify to get a business payroll tax refund through the Employee Retention Credit, also known as the ERC. The ERC is a tax refund for businesses that kept employees on payroll for parts of 2020 and 2021. If you own a business with more than 5 employees, you could have money waiting to be claimed right now. Innovation Refunds independent tax attorneys can help your business stay compliant with IRS regulations and guidelines. Innovation Refunds earn the highly coveted SOC2 certification. The SOC2 certification is a compliance standard developed by the American Institute of CPAs. It specifies how trusted organizations should manage customer data in the areas of security, processing integrity, confidentiality, and privacy. Innovation Refunds has hundreds of 5-star Trustpilot and Google reviews. They're also accredited with the Better Business Bureau. Innovation Refunds does not provide tax or legal advice. They work with an independent network of tax professionals and will share information with them to evaluate and process your claims. Go to innovationrefunds.com to determine eligibility. If you qualify, you could be on your way to receiving money for your business. There's no upfront charge since they don't get paid unless you get paid. Go to innovationrefunds.com or dial 1-843-REFUNDS. That's innovationrefunds.com or 1-843-REFUNDS. Terms and conditions apply. Why are they telling us now? Is anything they're telling us true? That's a question we can't answer because both Big Pharma and federal regulators have lied so routinely, so consistently that there's no reason to take anything they say at face value. If recent history is any indication, it's probably not a good sign for us. I mean, normally, when the federal government says a drug doesn't work, there are two possibilities when they say this. The first possibility is that they're trying to drive up sales of some other drug. We saw that during COVID. Don't take that therapeutic. It's a horse tranquilizer. Take our shot instead. In the case of these decongestants, there's long been a push to require prescriptions for these. In various states, activists and politicians have said that it's not enough to hide these decongestants behind the counter and to track their sale. They say that it's necessary to require people to get a prescription first. And this has been going on for a while. Here's one report in Indiana from a decade ago, for example. Watch.
Pseudoephedrine is one of the main ingredients in making methamphetamine, and some agencies want it off the shelves. But many are discussing whether this issue is a law enforcement situation only, or if it should affect the medical field as well. News 10's Sarah Schaefer has more.
In 2013, one box of pseudoephedrine was sold about every 15 seconds. That's according to officials with the Indiana State Police. They're one of the agencies in the group known as Indiana's Coalition Against Meth-Making Meds. Along with them, the mayor of Terre Haute.
Is a coalition of multiple groups across the state of Indiana that want to encourage the legislature to make this change, make it a prescription med so that we can fight the meth problem that we have in Indiana.
So this is the first possibility for why they're pulling these drugs, or they're gearing up potentially to pull them anyway. Maybe it's part of a larger effort to shift these decongestants to prescription model so that more people are seeing doctors and pharmacists. And then also, by the way, there's more money being made by everybody involved in that case. That's one theory. The other possibility is that the FDA's fraud simply couldn't go on any longer because the evidence that they're lying about these drugs' effectiveness was becoming too overwhelming. And if that's the case, it wouldn't exactly be the first time something like this has happened. It was just a couple of years ago that the FDA unanimously approved an Alzheimer's drug called Aduhelm that didn't work. This is one of the most expensive drugs available on the market. It costs more than $50,000 per year per customer. But the approval process didn't go as smoothly as the FDA and the drug maker called Biogen would have liked. Several of the FDA's experts resigned in protest after the agency approved Aduhelm, even though there was no evidence that it did anything to actually treat Alzheimer's. Here's one of the experts who quit. Watch.
Does Aduhelm really do anything to stop symptoms?
So the new drug that the FDA approved in June targets amyloid plaques very effectively. Unfortunately, the drug doesn't seem to have any clear effect on the progression of Alzheimer's disease.
Dr. Aaron Kesselheim is professor of medicine at Brigham and Women's Hospital in Boston. He was on the FDA advisory panel on Aduhelm until he quit in protest when the agency gave the drug a green light, a move he calls probably the worst drug approval decision in recent U.S. history.
But how can you say definitively that it doesn't work any more than the FDA could say definitively that it does?
You can't say definitively that it doesn't work. You can't say definitively that it does work either. And in that circumstance, you need to do some more testing of the drug. The system in our country is that in order for a drug to be approved by the FDA, it has to show substantial evidence that the drug actually does work. And in this case, there isn't good evidence that the drug works.
As you just heard, the entire premise of the drug was that you can cure Alzheimer's by removing so-called sticky plaques in the brain. But it later emerged in the research supporting that theory, which appeared in Nature magazine, that it later emerged that all this was doctored. On top of that, serious side effects of the drug emerged, including brain bleeding. So why did the FDA approve the drug if there's no evidence that it actually works? It turns out the agency had a close relationship with the drug company Biogen that made the drug throughout the approval process. This relationship, Congress later determined, broke the FDA's own rules, but it worked out for Biogen. And we see this phenomenon again and again. The federal government tells us that a drug works and that they know exactly how it works. And by the time we find out that they're lying, the drug company has made a ton of money off of it. We saw something similar happen with SSRIs. For decades, we were told that low serotonin levels were linked to depression. Therefore, SSRIs would fix that problem by allowing more serotonin in the brain. Even as mass shootings and depression and suicide rates all went up, as more and more people were put on these drugs, we were assured by Big Pharma and the media that despite all appearances, the SSRIs are working. That was what the science said, they claimed. And if you disputed it, you're some kind of anti-science troglodyte. It only emerged last year that, in fact, low serotonin isn't linked to depression at all. And somehow that wasn't a major scandal. SSRIs, which stands for selective serotonin reuptake inhibitors, were never pulled from the shelves, even though the official position of the scientific community is that low serotonin doesn't cause depression. There were no massive class action lawsuits that bankrupted the companies that made billions of dollars from these SSRIs that don't do anything. Just as Biogen hasn't been held accountable for its worthless Alzheimer's drugs. And just as no one in the Sackler family went to prison for lying about the addictiveness of opioids. For all those reasons, we can assume Big Pharma and the government will continue to lie to us. If they don't face consequences, they have no reason to change what they're doing. That's why at this moment, our political leaders are gearing up for a new round of COVID decrees. These decrees have already arrived in Canada, where public health officials are now calling for children as young as 6 months old to receive COVID shots. Now, there are no clinical trials or studies that demonstrate that it's safe or necessary in any way to give COVID shots to 6-month-old children. Not a single one, not a single study. And to be honest, even if they had conducted trials, and even if there were these studies, there would be reason to doubt those as well. I mean, we're now at the point where whatever the class of drug we're talking about, whether it's Alzheimer's treatments, COVID shots, SSRIs, all the gender transition drugs on the market, even decongestants, whatever the drug is, you could just assume you're being lied to. If you consume drugs that Big Pharma and the federal government are pushing, you're running the risk that 10 or 20 years from now, you'll learn what that drug was actually doing. And it might not be what you thought it was doing. And you'll learn what the actual side effects might be. Whatever you take and whatever your kids take, you simply have to factor that doubt into the equation. You have to keep in mind that if something bad happens down the line, you'll be told that it's breaking news. No one saw it coming. Even though the people who made the drug, in fact, knew it was coming. Now, is this an ideal situation from a public health perspective? Of course not. But it's the system we have. And if there's any upside to the news this week, it's that no one, not even people who are just shopping for a decongestant, can deny it anymore. Hey, YouTube, thanks for listening to the show. If you'd like access to my full show with no ads, you should go to dailywire.com and use promo code Walsh to get 2 months free on all annual plans. See you there.